Welcome to the Prospective Doctor podcast, brought to you by Med School Coach. Pre-med and medical students alike are encouraged to tune in each week for tips on how to become a strong med school candidate, gain acceptance into the school of your dreams, and succeed on your journey toward residency and becoming a doctor.
Welcome, everyone. This is Arkita, and I'm here with a very special guest, Dr. Larry Benz, who's a doctor of physical therapy. And I'm really excited to talk a lot about what's going on in his world. And he has a new book coming out, so I'm sure we'll be chatting all about that. But I first want to give Dr. Benz an opportunity to introduce himself.
Well, thank you, Arkita. It's wonderful to be here. Again, my name is Dr. Larry Benz. I'm a physical therapist, and I'm currently sitting right now in Louisville, Kentucky, where I've been since the mid-1980s. I actually grew up in Cleveland, Ohio. I'm a physical therapist by training, but I have some other degrees as well. I'm kind of a fan of higher ed, so I've got an MBA, I've got a doctorate in physical therapy, I've got a master's in applied positive psychology. So all good stuff. And with started my journey, I was always wanted to be a physical therapist. So I knew in middle school, that's what I wanted to do. And I was an athlete, or sort of an athlete, but got hurt a lot and got exposure to athletic trainers and caregivers and physical therapists. And so my journey was really, predestined. I wanted to be, my calling was for PT right away. And so I went to undergraduate, and then PT then was a graduate school. I went to the U.S. Army Baylor program in physical therapy, had to serve my country as the U.S. Army in order to help pay for my education, which I was pleased to do. It was a wonderful experience. And then embarked in private practice physical therapy as I exited the military, started a private practice, and actually at some point sold that business and started again. I wanted to have an education company, a physical therapy company, and a company that did on-site work injury management. And that's what we did. And today, as we sit, we're 235 locations in about 14 states. We have a Fit for Work. We're in like 700 locations doing on-site work injury management. We have a program that trains physical therapists post-professionally in residencies and fellowships. And, along the way, my journey was one in which I was very perplexed at how non-clinical factors could lead to clinical success. So how you talked to a patient, how you listened, how you connected with them. Did that have any effect on care? There'd been all kinds of psychosocial research that really showed that, it had some meaning, but there wasn't a tremendous amount of data in it. And so my journey was to see if any of these things mattered. Do they matter to the patient? Do they produce better outcomes? Do they matter to the practitioner? Do they help as an antidote to burnout, for example? And do they help your business? I'm an entrepreneur, a business person, and can it help differentiate and give me some competitive advantage in the marketplace? So that's the short story of how we got here. And so it culminated with getting a master's degree from the University of Pennsylvania in applied positive psychology, where I extensively studied the interventions, techniques that could be transported or translated into healthcare. And fortunately, that culminated in a capstone thesis and eventually a book entitled Call to Care. So we've been wrestling with this sort of issue since 2013. And I can't think of a better time now with what's going on with COVID and the unfortunate trade-offs and circumstances that we have, but also tremendous, focus right now on diversity, equity, and inclusion. And how does empathy and compassion play a role in that? Perspective and bias and all the cognitive soft skills that we are giving credence to, and we should. So that's it in a nutshell.
You summarized everything so well. It seems like we went through the spectrum from the 80s until now and all of your education and research. And I think it's a lot of exciting topics that we can dive a little deeper into. I think that you're the first person who I've met who has a master's of applied positive psychology. Can you tell us a little bit more about that? And if someone were interested in pursuing a degree in that, how could they apply it to different careers?
No, it's a great question. So let's talk about the field of positive psychology. So the field of positive psychology was essentially initiated or co-founded by Dr. Marty Seligman, who's written a tremendous number of books and published research. And he is the PhD psychologist at University of Pennsylvania. And he, along with some other co-founders, started looking at psychology, which tended to have the disease model. But their perspective is what is going right and how can we do more of it? So it's more of a positive bent to it. over the time, just hundreds and now thousands of articles that have been published research on positive psychology. And it tends to have sort of verticals. So education would be a positive psychology vertical, positive corporation. So business would be a vertical. Healthcare obviously is one as well. And then it trickles down to everything from leadership and coaching to positive psychology influence as well. So that's kind of the larger program. It's at University of Pennsylvania. It's called MAP. However, there are lots of other snippets. There are online certification programs in positive psychology, both at University of Pennsylvania and I think the University of California, Berkeley. There is a free Coursera course by these same giants of positive psychology that teach at University of Pennsylvania, such as Marty Seligman and Duckworth, who wrote the book Grit, and all of that faculty that we were able to have good access to when we were students. So it's a tremendous field that now is accessible from an education and a certification standpoint, literally for anybody, at least the core concepts.
That's awesome. And in your book, which I would like for us to talk a little bit about, called A Call to Care, a Medical Provider's Guide to Humanizing Healthcare, you mentioned a lot about positive psychology. How would you suggest that someone who is early in their journey balance telling patients the truth and what's real in a positive manner?
Yeah, so I think one of the things that we learn a lot in healthcare is we learn a lot about interventions and diagnosis and objectifying about everything. So an example is, patient comes in with an injury. You say, how did you hurt it? Where did you hurt it? How long ago did you hurt it? Have you ever hurt it before? What treatments have you had for it? And it's all these objective things about it. And we've really encouraged our practitioners to take an approach to also ask about people's feelings. And how does that impact their lives and their activities of daily living? And so I think you have to take the perspective of a quality connection is very meaningful. The research shows over and over that how you connect through mutuality and vitality of the relationship and sharing emotions with your patients, that really has a meaningful effect on the outcome of the treatment. I also like to tell people that it also results in better care and better how you feel about that care. So burnout is a very real thing that happens in our profession. And how do you prevent it? And one of the ways you prevent it is by connecting more with your patients, empathetic listening, having an understanding of goal setting and the types of goals that you can set with your patients. And so we really take the view that these so-called soft skills, they're also called cognitive skills because we learn hands-on. But how much do we learn about emotional intelligence? How much do we learn about how to manage ourselves and our relationships? How much do we really learn about empathetic listening, about emotional handling, about peak end effect, and all of these other self-efficacy and the like? And do those matter? Well, yes, they matter, but these are skill sets you need to develop and you need to be taught them. You need to demonstrate them. You need to have feedback on them. And to me, they're even harder, these so-called cognitive skills. Like, how do I overcome a bias about the patient that I have? And so how do you become aware of that bias? And then what are the techniques that you can use to overcome them? And I think we could take that to the general population as well. And so we really are seeing a resurgence and an emphasis now on soft skills. Soft skills are the new hard skills. And we're really seeing that they can have dramatic impact in multiple ways. It can also make your organization better. And, quite honestly, it could set you apart from a competitive standpoint in your marketplace. So there's no bad things about empathy, compassion, and soft skills.
I love that. And that brings up a good point with you mentioning emotional intelligence and things like empathy and stuff. Do you think that is something that could be taught? Or is it more someone having innate skills and someone just trying to help them utilize them more?
Well, so there's so-called, these strength factors and what are characteristics that you develop over time versus that you're naturally born with. So we do know that empathy, for example, depending on how you define it, that some people are more gifted in it than others. But we also know that empathy and these so-called soft skills are like muscles that can be developed and nurtured over time. Empathy has been extensively studied. There's been meta-analysis, systematic reviews of empathy. And the one thing we know is when you start medical school with a certain amount of empathy, you tend to lose it by the time you've finished med school, which is not a good thing. And so what we found in the other research that we've done on it is that, yes, you can not only teach people about empathy, you can hold them accountable to it, and that it can be replenished, but it has to be consistently taught and reminded by. We believe very strongly that you can hold people accountable to it by measuring it. We also know that empathy has a multidimensional construct, and so there's the sort of compassion part of it, there's perspective taking, there's the emotional sharing of it, it's doing it in an environment of non-judgment, and then there's the pro-social concern. Am I motivated to do things for my patients? So if you really look at how people score on empathy, you really have to look at what specifically they're scoring, because empathy has about 4 different traits. It's not just one thing. And really, you'll hear sometimes people talk about compassion, which is extremely important, but compassion is an element. All compassion is empathy, but not all empathy is compassion.
That makes complete sense. And I'm curious to know if you think that, and it seems like you would agree, because you mentioned a few times that like future providers should grow in their empathy, but how do you think that humanities should play a role in medical education? In what ways can we incorporate that into certain curriculum?
No, I'm a big fan of the humanities, and you're seeing a reset within medical school curriculums to bring humanity, literally humanities, the arts, everything that goes with it, from music to artwork itself to opera to all of the other literature and everything that we classically call humanities. What has tended to happen, because we've shifted as a culture to one that is very bent on multitasking and doing things, and we've forgotten the humanities. Well, the way you restore humanity is by emphasizing the humanities. And so I'm glad to see that lots of medical school and other curriculum are mandating courses again in philosophy and literature. And there's actually been medical school research done that's demonstrated, and I cite a lot of this in the book, about which specific books and movies have been used to help replenish empathy. And there's plenty of them. And so it needs to be a continued ongoing support. I mean, at the end of the day, you want to deal with a human in your interactions in healthcare. And the only way to deal with human is to get them more into the humanities. So a big believer in it.
At Med School Coach, we know that getting into medical school is hard. In fact, 60% of pre-meds who apply to a medical school don't even get accepted. And if you want to get accepted into a top medical school, it's even harder. That's why more students than ever are turning to MCAT tutoring by Med School Coach. Our tutors are all 99th percentile scorers, have been through rigorous training, and can help raise your MCAT score by 12 points or more. You need every competitive advantage you can get to get into med school, so why not get one-on-one tutoring from Med School Coach? Our expert team will create a custom program just for you and help you master MCAT content where you need the help most. You'll raise your MCAT score. We guarantee it. Visit us online at medschoolcoach.com and use offer code PODCAST10 to save 10% up to $400 on a Med School Coach MCAT tutoring package. You can achieve your medical school dreams, and Med School Coach can help.
I completely agree with that. And that brings up an interesting point. There has been a lot of push in the recent years to incorporate more technology and AI into healthcare. Do you feel like that is devaluing like patient contact? And can people still incorporate humanity if they're, for say, practicing telemedicine or virtual care?
Yeah, it's a great and a timely subject. Well, certainly I'm an advocate for anything technology can do to make the system more efficient, more effective, with better efficacy and research and empirical support of it. So big fan of all those things. But at the end of the day, you can't replace the basics of rehumanization. And one of the things that we've noticed in telemedicine is if you're just using it as a robotic way to deliver care, it's not nearly as effective, because you have to have a combination of interaction where you're noticing body posture, facial expressions, and change in voice. You know, without those combinations, you're unable to form a high quality connection. Without a high quality connection, you're not going to have as good outcomes. So you need to be mindful of all of these human features that allow the integration of a patient and a caregiver. You know, as much and as sophisticated as healthcare has gone, the basics of it, the interaction component, really at the end of the day is between that patient and whoever their caregiver is. And you certainly want a human element to that. It makes the care much more effective, better outcome at a lower cost. And at the end of the day, it's good for everybody, including the practitioner, who suddenly now is restored into their calling of why they became in healthcare in the first place.
That's a good summary. So it seems like there are great ways to leverage technology, but you cannot forget the things that make humans humans and the things that are unsaid, like body language or the inflections in voice, or when someone may not necessarily be saying things, but they're showing things. And it's up for the provider to utilize ways to maybe encourage someone. I know in a patient room, in a patient setting, I may notice that someone may look sad. Whereas if I'm on a phone call or something with them, they may be able to not necessarily bring that forth, and I may not ask more questions. And to be honest, it's something that I am personally struggling with as a family physician who is working more in telemedicine. And I definitely believe in the future, and that it's something that we will grow and develop and make more prominent, and also help decrease certain barriers to care and increase all of the access. But we can't forget the human connection and human components of a doctor-patient relationship and the things that they bring when you come together. Or even if you're doing it virtually, like videos, like we're looking at each other. I know you guys won't be able to see us because it will be a podcast, but we are doing a Zoom and we're looking at each other, and right now we're both smiling, but like you can't see a smile in certain instances on a phone or something. So thinking about those components, and if you aren't able to do that and you still need to provide care in rural areas or something like that, taking that into account and maybe asking a little more questions or setting up some time for you guys to meet in person to follow up.
Yep, no, absolutely. I think the example I try to give to our students is, how many of you have ever misinterpreted tone in an email or a text message?
Mm-hmm.
All the time. And because you don't have changes in, your voice, posture and facial expressions. I said, how many of you have enhanced your text messages with emoticons? Well, that's closer, and that's a better improvement than just a straight text message. So people do get it and they understand it. There's parts of healthcare that are very transactional. Here's your medication, here's the test you need. But at the end of the day, the complexities around healthcare, particularly in a COVID world where you've got patients with, all kinds of comorbidities and metabolic disease and diabetes and respiratory problems, if you don't form good, high quality connections, they're going to have less adherence to your instructions, to the medication, less compliance, less result.
I totally agree. And speaking about certain things that can help patients in a way that is utilizing technology, there was an article in the New York Times discussing virtual reality as therapy for pain. Can you talk a little bit about that?
Yeah, absolutely. In fact, our company, Confluent Health, is partnered with a company called Behavior VR on a virtual reality product. So let me talk to you about what that is and what it isn't. So the interesting thing about chronic pain is that we have 50 to 60 million Americans that have chronic pain. In fact, opioid addiction is still the pandemic behind the pandemic. It is actually accelerated during COVID, unfortunately. Mm-hmm. We also know that post-COVID, there's likely to be more like 70 million Americans with chronic pain because of all of the impact of the disparities in healthcare that we've seen. So how do you deal with chronic pain? Well, the simple reality is most pain patients have never been adequately explained to them why they have pain to begin with. What are the biological, psychological, and social aspects of pain? And do they have any impact? Of course they do. So we have to teach patients about pain. We have to teach them what kind of things can trigger pain, what can cause damage, and what can't. Our automatic assessment is, well, any activity is going to cause more biological problems. Well, no, it doesn't. And we have to teach them about enhancing their activities, increasing their activities. We also have to be mindful of the behavioral health implications, anxiety and depression. And then we have to give them coping mechanisms, whether it be cognitive behavioral therapy or other interventions beyond the direct interventions. So what we have found is using VR, it kind of brain hacks you and forces you to pay attention to all of these different concepts, whether it be a concept of teaching you about pain, whether it's a concept of unhinging activity from pain, meaning the more activity doesn't necessarily cause more pain, whether it's about teaching you mindfulness and breathing exercises, whether it's about teaching you what other coping mechanisms can you do when you feel the trigger or an impact that you're going to have chronic pain. At the end of the day, it's very, very effective. It takes about 6 visits or 6 sessions. What we find is those patients have decreased healthcare utilization, decreased emergency room visits, decreased visits to family practice if necessary, less medication, and enhanced activities, less anxiety and depression. So treating of chronic pain is going to become, it is epidemic in the US right now, and it's going to become more so. And we have to have modules like VR and other things to help hack the brain.
I think that that's totally fascinating, and it's a way showcasing how we can think outside the box to treat an old problem, because we need to think of new ways. Like pain medicine and opioids aren't the answer for every situation. Now, there are some cases where things are extreme and they need it, but everyone should not start with that, and everyone shouldn't be on it chronically. So I love that we're thinking outside of the box in terms of that.
Absolutely. Yeah, it's great stuff.
Going to another thing that you mentioned that I found fascinating, both in your book and here, is that you mentioned that you noticed through some studies and surveys that most medical students feel less empathetic than they did when they started school. And in your book, there's a mention of a survey stating that over 51% of respondents were pessimistic about the future of healthcare. Half of physicians indicated that they would not recommend the profession to their children. And over 55% described their professional morale and feelings about the state of the medical profession as negative. To me, that sounds like burnout. What do you think are the reasons for these responses, and how can we work to improve on the morale of the current workforce?
Yeah, so I think what tends to happen is people are driven and called to become a caregiver and a healthcare provider. And then once they become a healthcare provider, the system does a lot of things to take them out of doing what they love best, which is treating patients. Well, how do they do that? They do it by making them, go through more hoops and ladders, pre-approval, authorization, verification, more documentation, more paperwork. So much of that happens. And that means the time that they actually have to care for their patient is far less. It's these external hassle factors, if you will. I hear teachers talk a lot about the same thing in the schools and public school systems, that they spend so much time not doing their craft. Over time, that has a very, very negative effect on them. But I also like to discern between burnout and dehumanization. They're two very, very different things. So let's talk about burnout for a minute. So burnout really in any field means that you no longer feel that anything you do is effective. You've lost the zest for it. You've lost any emotion around the joy of it. It's almost a clinical diagnosis. It's not really depression, but it's close. And that happens over a period of years. That's very different than you as a family practice physician seeing 20 patients, and by the 5th patient, man, you're rushed. And so what happens is you get what the call center research they call calcification. You literally calcify. And that's an equivalent word to dehumanize. All of a sudden, the patient is no longer Mrs. Jones. It's Mrs. Jones flu. It's the flu patient. And that 2-dimension is a natural occurrence because you get this temporary dehumanization. So there's a fix for that. And that fix is whatever your fix is. If it's mindfulness, if it's breathing techniques, if it's taking a 5-minute break, a cup of coffee, getting some fresh air, whatever it is that can bring you back to the path of humanizing your patient and remembering you're dealing with a third 3-dimensional object on the other side who has real feelings, who has a truth, and their perspective is their truth, whether or not you agree with it or not. And so that is the whole notion behind rehumanization. Burnout also has an antidote. And really the biggest antidote for burnout is reconnecting to your calling and remembering why you were called to do what you do, and then trying to take on empathy, perspective taking, emotional sharing, high quality connections, capitalization, self-efficacy, all of these, again, soft skills that can be transported to you as a practitioner over time we have found that those who are the most empathetic, the most compassionate, have the least burnout. So both of them have a fix, but burnout is much more profound. And it's a sad case when half the physicians in certain professions are claiming burnout. It's really, really sad. I'm hoping that COVID has brought back some heroism to healthcare. We know anecdotally that applications to medical schools are up right now, in part because what COVID has shown is how healthcare are really heroes. And so hopefully we can leverage that to the betterment of the profession, education, and the system at large.
I love that because I think that it's real. And in discussing a lot with my friends or even my personal experience, it's okay. You have to, first of all, recognize that a patient is a patient. They shouldn't be room 3 or that hypertensive, like they are Miss Susan or Mr. Bobby or whoever it is, like they are a person first. And thinking about that, and one of my mentors told me before, like when I was feeling kind of overwhelmed, I think in residency, and they were like, when you go into a patient room, you may have seen 15 patients today and you may be ready to go home, but this is the only visit of the day for Mr. Jones. So you should give them the same attention that you gave to your first patient of the day when you had your coffee and you were all ready to go. So it's important to treat people as patients and not as numbers. But then on the flip side, physicians and other healthcare providers are not robots. So it can be difficult when you have a patient at 12:15 who you're giving a new cancer diagnosis, and you may sit in the room as a human and cry with them or hug them or something like that. And then you have to go into the next room like 2 minutes later and do a well child visit, and patients are doing all of these things. So you're dealing with the emotional trauma of your visits, but you are kind of being like a performer or an actor because you haven't necessarily had that time to process what you did 10 minutes ago because you've moved on to the next one. So I liked how you mentioned that it's okay to think of those small things you can do during the day outside of the other stuff that you do that makes you you, whether or not it's deep breathing or taking a moment, going in the bathroom, saying a prayer or something to help you realize that it's okay to have feelings and you don't have to be like an expressionless person.
That's correct. That's absolutely correct. You don't have to absorb all your patient's problems. Mm-hmm. That's not what empathy is about. What empathy is about is relating to them. Mm-hmm. As you said, whatever your thing is that will jumpstart you back, it's very personal. Music, it is for some folks. Whatever that is, you need something to put you back into the recognition that you share a lot of the same things with the person that you're having. The thing that does scare me a little bit about some aspects of telehealth, about some aspects of artificial intelligence, about people that simply do Google searches on their diagnosis and then self-treat, is that they're not going to get any of that. And the research shows that those high quality connections and these other factors have a dramatic impact on adherence, compliance, and others. So we really need to continue to embrace healthcare as a profession that engages a professional caregiver and their patient.
Absolutely.
At Med School Coach, we know that matching into the specialty of your choice and the residency program of your dreams has a dramatic impact on your career as a physician. And your USMLE score is the most important acceptance factor of all. That's why more students than ever are turning to Med School Coach for USMLE tutoring. Our tutors are all 260 plus scorers and have been through rigorous training. Plus, the average student who uses Med School Coach tutoring raises their score by 23 to 55 points. There is an enormous amount of material you need to know for Step 1 and Step 2, and Med School Coach can help you be smart about how to study. We'll create a custom program just for you. Then, we'll help you master USMLE concepts where you need help most. You'll raise your USMLE score. We guarantee it. Visit us online at medschoolcoach.com and use offer code PODCAST10 to save 10% up to $400 on a Med School Coach USMLE tutoring package. You can achieve your medical school dreams, and Med School Coach can help.
And another question for you as we're talking about the healthcare system and how it's changing and evolving, what do you think one of the biggest changes needs to be in, say, the next 5 to 10 years in the healthcare system?
Yeah, so we have a complete influx of patients that need care, but a system due to regulatory constraints that does not allow practitioners to practice. You spend way too far much on the telephone getting things approved. You spend far too long on paperwork and process improvement stuff that does nothing in the healthcare chain to bring quality or value to it. So we're going to need some aspect of deregulation so that we can have more innovation, so that we can treat more patients effectively. The fee-for-service system that has existed for years has created unintended consequences. So we like to refer to it as value-based treatment, but that value-based only will work if we allow practitioners to practice at the top of their license and spend the quality time with patients that they need to. Because unfortunately, we have lots of rules and regulations, but not a lot of care right now. We need to bring care back into healthcare and enable our practitioners to practice their craft, and we're all better off. But without some aspect of innovation, in the absence of the regulations and the paperwork that the insurance companies, CMS and Medicare, that force us to do to just allow us to practice, it's all backward right now. And that has to be shifted, in my opinion.
I agree with that. And I know that you have your network with the Confluent Health and all of that. And I know that a lot of primary care doctors are moving away from the traditional organizations and hospital-based systems to do more of what they call direct primary care. Do you think that movement will help bring some of the care back?
I hope so. I'm a big fan of direct primary care. I'm a big fan of self-insured companies taking and managing the healthcare, being advocates. You know, our healthcare system is very complex to navigate. It's not if you're young and healthy, but if you've got multiple diseases and vulnerabilities going on, it's impossible to navigate. And then on top of it, you get all the hangups with insurance verification and all of those things that occur. And the reality is that really lessens the impact on what good healthcare is about. When you really look at the growing healthcare disparity that we have in the United States, now coupled with what's going to likely occur, which is educational disparity. And educational disparity, in part because of COVID, only leads to even more healthcare disparity. They're correlated. And when that happens, in the presence of a very highly regulated environment, you're going to have way too many patients with not enough people to give them care. And so I'm hoping that these items, they take away some of the obstacles that allow us to put our hands on patients, spend time with them, and explain things to patients. Because, in the absence of that, we don't give them the right instructions. We don't give them the right, diligence that they need.
Absolutely. Well, you shared so many awesome pearls of wisdom to us. My final question is, what is the, I guess I would say, biggest lesson that you've learned in your journey through healthcare that you would like to share with those who are early in their careers?
Yeah, I think the biggest lesson I learned, and it's a very simple, but I think has a lot of wisdom, and that is you have to be reminded. We call it in our company remind. You have to be reminded why you went into healthcare to begin with. Go back and look at that medical school application. Go back and look at some of the different things that reasons. And you were called for a reason. And oftentimes we forget what that is. We forget that the patient, if I'm talking to one of my therapists, came in and they couldn't walk, now they could run 5 miles. And we take it for granted, and we become so adapted to the heroism and to the work that goes into it that it seeks no longer to be meaningful for us. The only way we can do that is to reset and to remind and to get those patient vignettes and to get those thank you cards out and to get testimonials and all the things that go with it, because they will jolt us back. That's why I went into healthcare. And unless we have some effort to remind us back to, with regularity and a good cadence to it, we're likely to wane off into certainly dehumanization and, unfortunately, at least according to the research, burnout as well. So there are antidotes, but they take effort.
Absolutely. So I truly appreciate you for joining us today and giving us so many lessons. And I do want to plug your book one more time, Call to Care, A Medical Provider's Guide to Humanizing Healthcare by Dr. Larry Benz. And I read that all the proceeds will go to nonprofits. So kudos to that. So I'm sure we'll post a link in our description box when we list the show.
Awesome. I really appreciate it. It's been a pleasure to be on.
Thank you so much. And to everyone else out there, I'll see you next week.
Each episode of the Prospective Doctor podcast is brought to you by Med School Coach. To access articles, videos, webinars, and free tools to help you succeed on your journey toward med school and beyond, visit our website, prospectivedoctor.com. We hope you tune in again next time.